Good afternoon. My name is Yolanda Cook, and I'll be doing my presentation today on DKA, which is diabetic ketoacidosis. For my first presentation, I'm going to talk about what diabetic ketoacidosis is starting out. So, once again, I will be presenting on ketoacidosis, or DKA, as it is commonly referred to, which is the dangerous complication of diabetes. In this presentation, I will define DKA. I will describe the best practices that are meant to enhance the outcome of patients and present the research finding on DKA. I will also outline an evidence-based approach to decreasing the rate of DKA and the extent of its manifestation according to the evidence from the literature review. My explanation of the diagnosis. Diabetic ketoacidosis is one of the severe conditions that are related to diabetes, mainly type 1, but may also develop in type 2 diabetic patients under certain circumstances, such as infections, acute illnesses, or inadequate insulin doses. DKA occurs when the body lacks insulin to facilitate glucose to enter into the cells. Therefore, the body begins to burn fat to produce energy, and in the process, there is a production of ketones, which leads to metabolic acidosis. The symptoms of DKA can come on rather rapidly within a few hours. They include increased frequency in the desire of water, which is the polyuria, nausea, vomiting, abdominal pain, and in severe cases, disordered thought processes or altered level of consciousness, coma, or death for the worst instances. DKA is preventable if diabetes is well managed, but is frequent reason for hospitalization among patient groups of low socioeconomic status. Such patients are those who cannot easily access healthcare services or those who have a low level of health literacy on diabetes. Research question developed using the PICO. For my research, I used the PICO-T framework to develop a focused research question. PICO-T stands for population, intervention, comparison, outcome, and time frame. Here's how I applied it. Population, diabetic patients that are vulnerable for DKA. Intervention, the provision of structured patient education programs that will enhance and manage diabetes and the reduction of DKA episodes. Comparison, standard diabetic care without structured patient education. Outcome, a reduction in the incidence and severity of DKA. Time frame, over a 6-month period. PICO question, in diabetic patients, the structured patients education compared to standard diabetes care reduced the incidence and severity of diabetic ketoacidosis over 6 months. The summary of my evidence and sources is this PICO question was useful to help me find evidence to answer the question on the measure that can be implemented to prevent and manage DKA. Sorry, I'm just getting over the flu. In order to answer my research question, I had to review 3 articles that discuss various aspects of the diagnosis of DKA and related them to my evidence based on my intervention. The first article is by O'Reilly, ETAL 2021, that I considered, that is a nationwide cohort study from the Scotland that is aimed to evaluate the evidence of DKA in patients with type 1 diabetes monitored over 14 years. The findings of this study are that DKA rates were rising during the study period, especially in the patients with low socioeconomic backgrounds. It discussed the patients using insulin pumps and those who participated in the structured diabetes education programs have lower DKA rates. The second research I considered was a quantitative study, and it was of the experience in managing the DKA in the low economic status population in Queensland, Australia, conducted by James et al. 2021. The study further elicited that due to the increased access to adequate medication and equipment, such as ketones testing strips and CGM technology, the prevention of DKA remained difficult. The study also highlighted the insufficiency of the after-hour availability and acknowledgement that there is room for enhancing the patient's knowledge of their diabetic disease. The third article that I have reviewed was a cross-sectional study conducted in Saudi Arabia to access the knowledge of patients with diabetes regarding DKA by Eltam et al. According to the findings of the study, it is concluded that many of the patients had a pre-existing knowledge of DKA, but they lacked the adequate knowledge of the signs causing the management of the condition. Such knowledge gap results in delayed diagnosis, and therefore they have more severe complications. To answer the PICO question based on evidence, the evidence I reviewed consistently supports the idea that structured patients' education is an effective strategy for reducing the incidence of severity of DKA. First, the Scottish cohort study showed that the patients with T2DM who underwent structured education concerning diabetes had a lower risk of DKA and higher likelihood of using insulin pumps for managing blood glucose levels, as explained by O'Reilly and al. Similarly, in the study conducted in the Saudi Arabia case, which the patients needed to have more information on how to identify the DKA, the factors that may lead to it, and when one go to seek medical assistance, the sources also show that most patients lack adequate knowledge about the lack of insulin and DKA, which contributed to the timely treatment. This was also evidenced by the Australian study when it was also pointed out that a patient with sufficient education and facilities was in a better situation. To stakeholders involved in healthcare delivery should aim to remove hurdles such as how ketone testing strips as well as glucose monitoring devices are inaccessible. Key steps of care based on evidence. Based on the evidence I reviewed, the following steps of care are recommended for reducing the incidence and severity of the DKA. Implement structured diabetes education programs. It is recommended that the healthcare provider designs and implement comprehensive patient education programs that deal with diabetes, DKA prevention, and necessities of insulin administration. These programs should be developed into taking into consideration the literacy level in the patient, his or her health literacy level, and individual culture into consideration. Promote early recognition of DKA symptoms. Patients should be instructed on the signs and symptoms of early detection of the DKA, including polydipsia, polyuria, nausea, abdominal pain. Such symptoms, therefore, should be detected early so that the appropriate action can be taken to try to reverse the situation. Ensure access to medical supplies. It's essential that all diabetic patients have access to necessary medical supplies for monitoring blood glucose and ketone levels. This also entails offering incentives such as subsidies for ketone testing strips, glucose meters, and as well as the continuous glucose monitoring devices, particularly in the low-income or rural regions where they can't get anywhere. Offer after-hour support. One of the significant deficits in the absence and availability of services during the evening, weekend, or at any other time of the regular working hours. Having dedicated telephone lines and educators who are available for advice and to help a large community reduce the number of patients visiting the emergency room for preventable conditions of DKA. So the conclusion is, in the conclusion of the ketoacidosis, it's dangerous and it's a severe complication that can be avoided with good practices and management and knowledge about the disease. The presentation has supported the idea that the structured patient education program are effective interventions that can reduce the frequency and severity of DKA in patients with diabetes through improving the understanding, management of the diabetic disease. It is recommended that there should be a provision of better education and health care practitioners, provision of adequate supplies in hospitals, clinics, and other services for the patient's availability. These combined with the new technology such as insulin pumps, continuous glucose monitoring will go a long way in reducing the load of DKA to enhance the quality of life in the DKA patients. Thank you so much, and thank you for bearing with me with my sickly voice. Have a wonderful day.